Welcome back to MTP, Meet the Penis, number 14. We had some great guests in from out of town today. They were from California and Ontario, and we had just a wonderful day of cases. Yesterday we had a difficult case day, revisions that have come in from all over the place, and that group had come from University of South Florida, and just another wonderful day of training. And the questions just get better and better. This one, it just so happens.
Favorite urologist.
Come in. Hi. Go ahead. We're gonna get going. All right. So the questions get better and better, and it just so happens that this one, there's a lot of publications referring to this topic. All right, and this was from Wayne. I'm not going to use his last name, but the question was, does the use of a penile pump help stretch your corpora to reduce scarring and dilate it larger before surgery? So I'm going to talk about the use of vacuum pumps both before and after surgery. Go back to one of the first MTPs. The thing that makes your penis shorter is impotence. Impotence leads to corporal hypoxia, meaning low oxygen, leads to scarring of the corpora, the erectile bodies, leads to a shorter, skinnier penis. That's what makes a penis smaller. Absolutely. Now, does the vacuum pump or penis pump, let's just call it a penis pump, make a penis bigger? If it really did make a penis bigger, those companies would not be sold in only pornographic stores, and the medicinal ones that you can get at the pharmacy would be selling like hotcakes. What it does do, and I go back to preoperatively, Marty Deneen's work, which was really beautifully done with his PA Tom, and they looked at what actually the vacuum pump contributes to the patient preoperatively. There's no doubt that it makes it so you're experiencing less pain postoperatively, and they did show that for about 3 weeks of cycling, you did have some statistically significant gains. So if you're going to do it preoperatively, do it for about 3 weeks. I tend to just tell my guys that let's just get this implant as quickly as possible, because I don't want them focused too much on just this vacuum length, and oftentimes, you know, the lengths are variable based on the patient, and improper expectations are set. But if you're going to do it, I'd follow Deneen's group and do it for 3 weeks prior. I don't like my patients doing it for the week before, because I don't want any bruising or excoriation of the skin that can be caused by a pump. It just so happens that Gabriele Antonini, who was in one of our first MTBs, who's my partner in Rome, his group, and along with my numbers, we co-authored a paper looking at the use of the vacuum device afterwards, in addition to cycling the implant. So what I can tell you absolutely does work is if you cycle that implant a couple times a day, pump it up for 10 minutes in the morning, 10 minutes at night, you are going to get back some of your length and girth. That goes back to one of Gerard Henry's papers 4 or 5 years ago, and it's amazing. I just had one of my patients from a year ago text me that he didn't see much until the last 4 months, and he and his wife are thrilled with the exercise, the cycling of the implant has done for his penis in both length and girth. The paper that we just published with Gabriele and his group, it showed that if using the vacuum device over your implant, in addition to cycling, you can get even more. As long as you have an approved vacuum device that has a pressure release valve in it, so you don't have too high pressures on it, you can safely use your vacuum device over your penile implant to continue to maximize the end result of your penile implant. Because remember, and this goes back to, I don't know if it was MTP1, but the only thing that stops atrophy of a penis that's impotent is a penile implant. So vacuum devices, yet if you're going to use them preoperatively, 3 weeks, try to stay away from it for about a week so you don't have any excoriated skin. Postoperatively, our paper has shown that if you use a vacuum device in addition to cycling, you can get even more gains in both lengths and girth, or get back to where you used to be. So as we close the MTP 14, the message is it's safe to use it preoperatively, safe to use it postoperatively. Really get in your head the proper expectations. Don't be a patient that's dysmorphophobic, that doesn't understand where they are and where they can possibly be. And I can't wait to see you guys next week.